Right there. Now, I want to talk to y'all about pictures and things that you could see on NCLEX, because they're getting very innovative in how they do NCLEX questions. And so they could actually have you take, and they're already doing it with the ATIs, right? Y'all already seen those hot spots. So understand that that could be a hot spot question. You could see how easily that could get very misconstrued, and they could actually put on a YouTube video and stop it and say, now, hot spot where the esophagus is and where the trachea is. You see how they could take your mouse and identify that. Because here's how this works for clinical content. You have a patient that has issues with difficulty swallowing, right? What's that called? Dysphagia. And they could say now they're tying it back into the difficulties of the person swallowing and the risk for aspiration. And they could actually create a few questions here with the hot spots. I want y'all, you know, anytime you're reading something and it's never too early to start, think of, now how would they ask this as an NCLEX question on state boards? So I always think that way. We'll move on. I think there's another spot down there.
Trachea. Food goes from the pharynx to the esophagus. Food moves down the esophagus by peristalsis. The peristaltic wave reaches the esophageal sphincter and food.
Another hot spot. Another hot spot. Identify what the sphincter is. Type the word. They could actually make you, could show you a picture, and then you have to literally type what that sphincter is, because that's how hard they're getting. And you say, man, that's, you know, seems like that's a lot of A&P. Well, it is. It's a lot of, they tie in a lot of A&P as in time to different disorders. So I'm just trying to point some of this out to you so that as you think about, as you're reading about things, to also think, how could they word this, or what could they do in terms of asking those complex questions.
Enters the stomach. The unique muscular structure of the stomach breaks up the food into small pieces called chyme. Chyme exits through the pyloric sphincter into the duodenum of the small intestine. The major portion of absorption and digestion occurs in the small intestine. The mucosa secrete enzymes that supplement the digestive enzymes of the pancreas and liver. This completes the chemical process of digestion. The walls are covered with villi where nutrient absorption takes place. The structure of each villus contains a capillary and lacteal to pick up the digested nutrients. The nutrients are now transported by the blood to all the cells of the body. The undigested food reaches the ileocecal valve and enters the large intestine or colon. The colon absorbs water, manufactures vitamins, produces mucus, and forms and expels feces. Mass peristalsis pushes the feces into the rectum, which stimulates the defecation reflex.
A good video. It's simplistic. Sometimes the most
That's just
simplistic
what I want
videos.
to look at. That one in the Latino, like what they got to do with that.
Yes, it's always good to watch them over and over. Because, too, when you watch that and it's real quick, it helps you understand in terms of, like, say somebody has an ileostomy or somebody has a colostomy, which we're getting into that. But how best do you position a patient? You know, in terms of helping them, in terms of their bowel function, or even they don't have to have a diversion type of system. but it just helps you to understand how the large intestine ascending, transverse descending. Anyway, we'll move on talking about the developmental stages, and you guys will have this again in about 3/4, but you should have a little piece of a little brush now in terms of the development stages. Infants, it is normal the first few days to have this green, black, tarry stool. Notice I even gave you a picture to this. For those that don't have the experience, right? Green, black, tarry stool that's sticky. That's a normal finding of the first few days of life. Because an older adult having tarry stool might be indicative of what? Potentially GI, some sort of GI bleed thing going on, but infants, this consistency is normal. And then, of course, they transition after those first few days of life, and depending on what type of formula, whether they're breastfeed or formula fed, the types of stools you'll typically see. Don't you love it? Now, you know they just didn't stick them in that toilet. Has to be a commercial. Yes, it has to be a toilet that's never been used. The ability to control defecation typically develops between the ages of 2 to 3. Typically. I won't say it's always because everybody's individual, but your textbook spells it out. 2 to 3. So someone that would be, some infant or child would be about 2.5, that would fall in the range, wouldn't it? That they have that ability. And as children mature, of course, they have more control over their defecation. We all need privacy for this. Maybe not so much with the urination. You see, but right? That's why, you know, we find a lot of hospital patients, they do have problems because they've been taken out of their routine, their usual environment. Not one of you can say that you feel comfortable using a foreign restroom to have a balcony. Sorry, I have to have my routine. We all have a routine. It's always challenging to think about, and I use the concept of soldiers. Can't you, some of y'all know what I'm saying, right? Sometimes you have more trouble out in that field, right? Brian, you'd say it, wouldn't you?
Oh,
yeah. So, I mean, you know, but we don't like to talk about this stuff. But I dare say there's a lot of young soldiers that experience constipation when they have to do these maneuvers. But we don't talk about it. That'd be a good research study to find out just how many do. So we talk about it. Do we? Oh, that's good. They probably put some sort of sprinkles in the food to make sure you have a stool softener, right? Because
everybody got an idea what they put in that food.
Yeah, well, you know. It's a gum. It's inside the gum.
You do. Our first
Gum,
day
in the gum. The laxative's in the gum.
line up in the circle and it's open. Rotation because all
Moderate the chewing of the gum then, right? Stress. Doesn't stress influence how your GI tract functions? Some of you guys have intense stress with an exam and I come up, I gotta go to the restroom and say, come on, guys. You know, I don't think all those times that students come up to me, it's just because they have the sudden urge to urinate. If you know what I'm saying there. So I never decline a student. They gotta go. By all means, go, please. Right? Right. But we find really a lot of stress in our work and our personal lives and even school can cause major problems with our GI system. And that's the fact. Proper nutrition and hydration and activity. I was, it leads to being regular. Fresh fruits and vegetables. It's healthy. And I've even listed out some specific items for y'all to make sure you focus in on. Those are fresh fruits, oranges. They're good for you. They're good for you. Fluids. Now everybody repeat after me.
Fluids.
Fluids. 6, 2, 8, glasses. Required to promote healthy outcomes. Now, if y'all happen to see that in your readings, and then you see some other numbers in your readings, which one am I going to expect you to know?
6 to 8.
You know, I don't tell my husband I can't go to the beach for no reason. Physical activity. See, I had physical activity yesterday. All right, that's good. Keeps me regular. Where I fall down on my health is proper hydration. I'm first to admit I probably don't take in enough fluids. I think we could all sometimes say we're guilty of that. And then also those fresh fruits. Fresh fruits. Medications. Now, antacids may slow down the system. Aspirin may cause gastric irritation. Those NSAIDs that y'all probably already learned, hadn't y'all already covered that? Probably, for sure you've covered something, right? In pharmacology. Antibiotics. What they do is they will decrease that normal flora. We have this normal flora within our system. And sometimes these antibiotics will wipe out our system. Hence, I see at the nursing home, and you guys too have been going, and in their bulk drawers of their carts, don't they have probiotics? Probiotics now. Yogurt is another way to combat that, to help us to maintain our normal flora. You have a person that might have been traveling in a different country and they've developed some sort of intestinal infection. And hence they were on antibiotics. You would encourage them to take yogurt as a, and that's just a real simple fix. We know that iron is notorious for causing constipation. Iron's necessary for those, especially those that's got anemia. And iron also has the commonality of causing our stools to be dark, right? Pain medication, somebody said earlier, slows down the peristalsis. We have other drugs, Lamotil, for instance, is used to treat diarrhea. If you have someone with what they call C. difficile, Clostridium, within their system, that's an infection, right? And they do have frequent stools, and you can usually smell Clostridium difficile a mile away. It's an odor you don't forget. These individuals, they need to get this out, right? They do need to get this out. I'm just giving you some heads up that not that it's going to be on the test, but I'm just giving you a concept that you in your working field. You would not want to give them an anti-diarrhea type medicine, would you? That wouldn't make sense. You want them, because they're on a specific medication. They usually give them a Flagyl, EO Flagyl, to treat this C. diff. But you wouldn't, and because your tendency would say, well, they're having constant stools. You wouldn't want to ask the doctor for a anti-diarrhea medicine. Y'all do get that, right? Because you've got to let that get out of the system. Now, again, I'll tell you, that's not going to be on the test. This is for y'all's future careers. Because you're going to run into patients with many patients that got celiac. Surgery procedures. When the surgery procedure's done, puts everything, general anesthetic, it puts everything in the body to sleep, including the bowels. Hence, that's why you see many times patients NPO at least 8 hours before a procedure. They usually write NPO after midnight for whatever procedure, right? A lot of times they'll even have the patients on a prep if it's some sort of major surgery, see, and they'll have them take that prep the day before, and then NPO after midnight they have the procedure, whatever. This is an example of a surgery procedure, a hemocolectomy, where they're doing some sort of resection of the bowel. They have to go in, the surgeon's got to go in, and they're finding maybe there's a situation where a person has severe diverticulitis, these pockets that have just gotten totally out of control in a person, and they end up having to resect some parts of the bowel because they can't fix the bowel, to be honest. Sometimes that ensues what they call paralytic ileus. It just, going inside and manipulating and messing with your systems, it causes the body havoc. It's something that's not normal. It's like, it's not normal to have an IV, is it? That's an invasive. See what I'm saying? The body doesn't like things to be done to them or to oneself invasively. So there's high risk of paralytic ileus in some situations. And therefore you might see the patient come back from surgery with a Salem sump, an NG2, you see. And they'll have that to low intermittent wall suction. Low intermittent wall suction. That's the NG2, the one that goes into the nose, down into the gut. All right? Hooked up to low intermittent wall suction. You also will note that the patient will be NPO, nothing by mouth, until that peristalsis returns. They're going to get IVs. They're going to get, D5, Ringer's lactate, whatever. But they're not going to get to have meals until those bowel sounds return. Doctors will ask you, did you hear bowel sounds this morning? And you say yes or no, I didn't hear any. So we'll keep them NPO. See. How many's had some of these experiences? Morning sickness. Morning sickness. Oh, I had two guys at the bottom. I had to do that. As pregnancy. Yes.
Okay.
Yeah, and some, those external ones, those are varicosities. Varicosities, those can erupt from the, as progression of pregnancy, and it's just where there's so much pressure. And those are venous. Hemorrhoids erupt from venous circulation. A weak wall. Those are external. No, those are the anal area. So you can imagine that's external. They probably have some internal. And many, and it's embarrassing, right? I mean, right? Is this embarrassing? So a young adult woman had maybe multiple pregnancies, maybe has some history within her family of venous stasis, things like that, or maybe she doesn't. She's just the stress of pregnancy. That would be an embarrassing thing to just speak up and say, you know, I have this problem going on, right? Why do you think I put this out there? I want y'all to know of these things so that you might want to, in your assessment, be very thorough. And talk to those young adult women that this is totally embarrassing, right? Mm-hmm. But they suffer because if you can imagine, those are external, they have internal. How much pressure is on the internal wall, and what can ensue is, of course, constipation, right? Because as these swell, what do? They block the exit. See? Right? Don't
How they
forget
treat
these
it?
things.
Can they get rid of it while
They
they're
do
pregnant?
hemorrhoidectomy. They go in, they have a surgeon, a GI doctor that will go in and do a lysis and basically remove internal, external. Huh?
How long does it take before you can use the restroom after that?
Oh, it's painful. How do I know that?
No, she said how long would they be able to go
Oh,
after they do the surgery?
oh, it pretty rapidly afterwards.
Do they give you some?
Yes.
Okay.
But they make sure you're cleaned out good. How do I know? I'm one that's had the hemorrhoidectomy. I don't mind saying, and it's painful. That first,
I bet you do.
and what passes? See, they clean you out with Go Lightly the day before. You know, they
I
want
wouldn't eat
totally have
nothing.
it clean. And if you don't get totally clear, believe me, when the surgeon goes in there, he'll clean the colon before he does the cutting.
I bet that hurt.
Oh yes. Oh, it's very vascular in that area. You can imagine, very vascular. And the first, when I woke up, it was so painful. I thought I needed to urinate, but really, what the pressure was, it was the pain of and where they had ran fluids through to finish the cleansing process, and I still had it in my guts. So that's what had to pass, is the fluids that the surgeon had still admitted, you know, during the surgery process. Let me tell you, that is a painful surgery.
I bet you
Very
it is.
vascular down there. When it's vascular, there's a lot of pain sensors. So I don't mind sharing, because I think if I tell you the story, and I don't make, you know, some things I'll ad lib, but that one I don't ad lib. I don't think I had external hemorrhoids that bad. I'm pretty sure I did, because I've tried to find the words somewhere. But I tell you this because it could happen to anybody. Male, female. And the fact that we don't want to address this, and we let people go along this path and we don't address it because they're embarrassed, see? But see, it leads to dire consequences for our patients. Why not? Let's have it out in the open, right? Let's just have everything out in the open, because there might be, your patient might be suffering from this, but they're too embarrassed to say it. Diverticulosis. Huh? How would you what now?
How would you go to the bathroom?
Oh, you're constipated.
Painfully?
You're very constipated. You have bouts of really, and they flare up and they swell. You know, they go through remissions and exacerbations, believe me. And it's painful. And the problem comes is we don't address it. We don't investigate enough. Assessment, right? Y'all won't forget this. Please don't forget this. Especially you guys that wants to be those OB nurses, right? Because the young adult female is going to be too embarrassed. Who knows? I might be giving this lecture, and there's some of y'all in here that's going through this experience. You see what I'm saying? It's all right. There's hope. There's hope for one. Seek out help.
Seek out help.
I did.
Don't be in no more pain.
I did, and I'm glad I did. All right. I can tell you, my mom had to have the surgery, so it could be it's a familiar kind of thing. See, with this varicosities, you know. But you don't know. You know, you have some family members that might be having some experiences. We'll move on from that. Y'all got the gist of what I'm trying to say here, right? What I'm trying to share. Diverticulosis. These are these sort of pockets, and you can see these. I know this is a illustration, but there are these little out pouches that can form within the lining of the intestinal mucosa, and these frequently develop in individuals who have maintained this low residue type of diet. They throughout their life, you see. They've set themselves up for that. And sometimes I say, well, we need to be better educators for our parents, our new parents. If they teach the child early on the importance of hydration, water, drinking plenty of water, and fresh fruits and vegetables. See, but we just gotten the fast fix is McDonald's, you know, those kind of low residue kind of things, not the fresh fruits and stuff. So what happens is these things can occur. Another big instance with this condition is related to obesity. Let's see what this video has.
Hi, this is Dr. Joe Galati, and we're going to be talking about diverticulosis in this video clip. And this is a very common abnormality that we see at the time of colonoscopy. And in this particular case, this was a 50-year-old gentleman who was going for a screening colonoscopy and had some vague left lower-sided pain. And as you can see here, most of his entire lower colon was full of these diverticuli, which are these outpouchings in the lower colon. It's a very common problem. Up to half the patients over 60 years old have diverticulosis. Now, many times you may have absolutely no symptoms. Other times you may have some vague abdominal pain, some bloating, and some discomfort and constipation. Certainly you could have more complications related to diverticulosis, which is diverticulitis, which is infection of the colon, which can lead to serious complications, including abscess formation, perforation, and the need for surgery, and this would be considered a medical emergency. But certainly this is a good illustration of diverticuli. The remedy would be to increase your dietary fiber. We like to say between 35 to 40 grams of fiber per day. And certainly reduce the amount of processed foods. As always, for more information, contact us through our website, texasliver.com.
That's a nice short clip, gives you the idea. That's
You can see inside the colon.
Remember Katie Couric on that. Harry Smith, I think. Clip on those.